Is manual lymphatic drainage or lymphatic massage actually necessary to treat lymphedema? I'm Dr. Alex Hill. I'm a board-certified physical therapist and I specialize in lymphedema, oncology, and pelvic health. In this video, we're going to go through what manual lymphatic drainage is and what the research says about its role in lymphedema management. Manual lymphatic drainage, or MLD, is a gentle, hands-on technique that uses light to moderate rhythmic movements to help your lymph vessels pump fluid. The idea is not to push that fluid out by force, but to gently stretch the skin and tissues in precise directions and sequences. That stretch stimulates lymphatic vessels, encourages lymph fluid movement, and it reroutes the fluid to areas that can drain it better. Think of it like giving your lymph system a little coaching to pump a little bit more and to take the detours that will get things flowing again. MLD is one part of complete decongestive therapy, or CDT, along with compression, skin care, and exercise. This combination is still the gold standard for lymphedema treatment. There are two phases of CDT, and MLD can be used in both of these phases of care. The first intensive phase is when we're working to actively reduce the swelling, and it can help get things moving and soften any fibrosis or hardened tissue. In the maintenance phase, which is all about long-term management, MLD can continue to provide symptom relief by stimulating lymphatic flow. Because MLD can be time-intensive with having to set aside time each day to do it, many people wonder if it's really a necessary part of short and long-term lymphedema care, or if it's more optional. Some studies show that it doesn't always reduce the size of the arm or leg very much, but more recent research highlights that MLD does far more than what we can measure with a tape. Physiologically, it can improve circulation, reduce tissue stiffness, stimulate the pumping action of lymphatic vessels, enhance immune system function, and positively affect different things like biomarkers, hormones, and the nervous system. Studies using a special type of imaging called ICG lymphography have shown that applying MLD helps increase the flow rate, change lymph flow routes, and help compensatory pathways become active. MLD also has calming effects on the nervous system, which can help with reducing pain and some of those feelings of heaviness. And functionally, people often notice that they move better, they have less tightness, and they have an overall sense of just feeling lighter after MLD. MLD seems to be especially helpful in situations where compression is limited or difficult. This includes compression at the head or the neck area, the pelvis, or the trunk. Additionally, some research suggests that people with mild lymphedema may see some more measurable reduction of swelling with MLD, whereas those with moderate or severe lymphedema, compression and exercise carries most of the load, and MLD helps more in terms of comfort and function. Because lymphedema presents differently in every person, treatment really has to be customized to the individual and how their lymphedema presents. So, is MLD necessary? So, although it does depend on the individual, overall, yes, especially when we look beyond just the volume reduction and doing measurements with a tape measure. We know that MLD helps to improve lymphatic flow and movement with dysfunctional lymphatic systems, and it certainly has a place to stay in the gold standard for treating lymphedema, which is that complete decongestive therapy, or CDT. The best next step for you is to talk with your certified lymphedema therapist about what's right for your presentation of lymphedema, including how often to do MLD. If you're not able to perform MLD, there are some alternatives like pneumatic compression devices to do the work for you. If you need help finding a lymphedema therapist near you, check out the resources that I have linked in the description below. And if you'd like to learn how to do lymphatic massage for your lymphedema, follow along with my guided videos. I have lymphedema massage videos that guide you through how to do it for the head and the neck area, the breast, the arm, the pelvis, and the legs, so head to toe. If you found this video helpful, please like, subscribe, and let me know in the comments what has been your experience with lymphatic massage or MLD.